First of all, as usual, I'd like to acknowledge and pay our respects to the Kaurna people, the traditional custodians on whose ancestral lands we gather, and acknowledge the deep feelings and attachment and relationship of the Kaurna people to country, and respect and value their past, present and ongoing connection to the land and cultural beliefs. Welcome to musculoskeletal program. There's 30 of you around about, 10 or 11 at the Queen Elizabeth and the rest at Royal Adelaide Hospital. I just want to go through the nuts and bolts of how the course runs, and I'm just re-recording this, I hope. Usually these things play up. I'm re-recording this for to put on the website, because we've got a recording from a few years ago and it might be slightly different things now. I'd point out we've got Baruch and Zoe, our precinct officers over here. Zoe's the boss that keeps us in check, and Baruch and I will follow the lead, but I think we're all here to help. We've down at the Queen Elizabeth Hospital, we've got Katrina and Rosie now, but the university nature is people move around all the time. So come grab a seat and sit down there. I'm recording this, as I said, so if anyone misses anything, they can always watch it back later. I went through a little introductory talk yesterday about musculoskeletal, and really just emphasised that it is really an important part of medicine. And I really meant by what I said about how one of the major advantages of doing medicine is the buzz you get out of helping people, and whether it's your mother who's fallen and broken a wrist, your grandmother who's broken a hip, your grandfather who's suddenly got a torn rotator cuff, you might need to give advice. And in any areas of orthopaedics medicine, there's radiology, pathology, and also a lot of the general medical aspects. There'll be orthopaedics input as well. So we all work as a team as part of the common goal to help patients, and we all get a buzz out of helping people. So for whatever reason you chose medicine, there's always going to be a bit of reward from the excitement of actually being able to give people advice, and orthopaedics will make up a part of that. The program, the nuts and bolts of it, really, as I said before, yesterday is two aspects. The two main areas, orthopaedics and rheumatology, headed by myself for orthopaedics, and with Peter Smitham, who was the past lead. Peter's based at the Royal Adelaide Hospital. I'm based at the Queen Elizabeth. And rheumatology, Susanna Proudman, who's currently on leave, and Sam Whittle. Sam's based at the Queen Elizabeth. Susanna's at Royal Adelaide Hospital, assisted by Simon Burnett, and we've got Rachel Black and a few other rheumatologists as well. We've got our rehab unit with Ruth Marshall, and previously based more at Hampstead, now it's more at the REPAT, the new REPAT Centre, and there's a whole heap of information on that online. We've got our sports injuries with the physiotherapist, James and Mustafa, and Terry Farquharson, our sports physician, who's actually been involved in looking after the Redbacks, the cricket team, and Norwood Football Club, and he's been quite involved in a lot of the sports associations, so he's really a wealth of knowledge. And we've also got our anatomy sessions with Marko Stojanovic, who's run every 3 times during the initial first 3 weeks, spine, upper limb and lower limb anatomy, and he's got little workbooks for you to do. And we've got our radiology has been put up online to get it a bit more up to date. Rheumatology involves a topic report. Now, it's all based around our campus website, and we've got this area here. I've mentioned the frequently asked questions. As pointed out, there's an issue with one of them. That's been corrected from yesterday. Brooks fixed that up. And we've got our introduction here. If you go just through these main pages, it will give you, first of all, I mentioned the rule of threes I like to use, and this is a little assessment technique mind map which I tend to use, where I think of things as being divided up into threes, traumatic, elective, a mixed picture, diagnosis, history, examination, investigations, and investigations making up the X-rays, ultrasounds, and MRIs, and then treatment being basically giving it time, conservative management, physiotherapy, injections, and then maybe surgery. So if you think of it that way, you keep it really simple. All of you will be really caught up on trying to remember every aspect of orthopaedics, and one of the lads mentioned to me yesterday there's a lot to learn, and you've got to be on wards and everything. That's part of medicine, unfortunately. But you don't have to remember everything. You just got to have a basic system to working things out. This is the lecture we'll be replacing, but also we've got our learning objectives here. And so if you're looking at what we really want you to know, just click on this area here, and hopefully it opens. And this is a little booklet on what the actual key things are. And we've based them down into the blue things, which are the definite things you need to know. Yellow and red became less and less more important. I mean, it's still important conditions, but we don't expect you to know it in full detail. Now, in reality, if we close all that, I already mentioned the tutors that you'll be exposed to. We've got a little list of those there, the instructors, with mug shots of us all, so you get an idea of who people are. And we go back to, so you've probably already gone through this already. I know some of you definitely have, because I know I've seen broken links up here. And we've got the timetables. Actually, I thought there might have been an issue with this, so we might just need to, it's popping up today. So yesterday it wasn't popping up on my screen, but we've got the Royal Adelaide Hospital timetable and the Queen Elizabeth Hospital schedule down here, which should pop up. And we just need, if there's any issues at all, we obviously contact the precinct officers and we can check that. See, it's not popping up on mine for the Queen Elizabeth today. The Royal Adelaide one was playing up yesterday when I checked it last night. Now, they'll tell you where to go and what to do. There'll be joint sessions and everything. Perhaps grab a seat over there if you, well, you okay? Yeah, that's it. Yeah. Yep, no worries. We'll spread out a bit. So, there's two aspects to the area, and for the Queen Elizabeth Hospital, there's a meeting with Katrina later on today. Is that correct? And she'll just go through the layout of the land. Zoe and Brooke are based here at the HMS, but they're looking after the Royal Adelaide Hospital team. There's two aspects. There's the Queen Elizabeth team will appear, and Katrina will go through how you self-divide into the clinics, theatres and ward rounds. You can't all turn up, all 30 of you turn up at one ward round. That'd be impossible, or even 20 at the Royal Adelaide and 11, so at the Queen Elizabeth. So you have to sort of divide yourselves up. Part of that's been sorted out by the Royal Adelaide with allocations already by Baruch, so it's spent a fair bit of time doing that. And that'll be, is that on this area here, is it, Baruch?
If you just scroll to the right,
scroll to.
Got the groups divided up just on the timetable.
On the timetable. That is, where's that, sorry?
Scroll to the right of that timetable.
Oh, okay, scroll to the timetable,
Yeah.
right, okay. Here we are. So there we are, good, okay. Okay, beautiful. And at the Queen Elizabeth Hospital, Katrina will go through how you allocate to the different aspects as well. Basically, the Royal Adelaide Hospital teams are divided up into three groups, theatre, ward rounds and clinics. I've just spoken to the registrar this morning to check the times. The ward rounds will start about 5, you should be at the orthopaedic office on 5, just next to 5G, about 5 to 7, where they'll catch up with the registrars, and then you'll go on your ward round. So it's a fairly early start. Okay, and then usually the ward rounds are finished fairly quickly in orthopaedics, so because they've got to get to theatres and clinics. So it's at 5G, or the office next to 5G at 5 to 7. The theatres start, they actually get a later start, I didn't realise until today, they get a later start at 8:30, so you should meet at 8:15 on 4G, where they'll go catch up with the registrars and you'll see which theatres are undergoing that day, and you can work out who's going to go to which theatre. And the clinics start at 9, so if you appear at 9 o'clock on 3G, and go through the clinics. There's usually a clinic most days, if not every day, either orthopaedics or spinal clinics, and the spinal ones are sort of divided up already. You've been allocated to those at Royal Adelaide. The other clinics where you self-allocate to which clinics you're going to go to for the Royal Adelaide Hospital clinic groups. So you go theatre. I don't know what the exact rotation is, but it's theatre, clinic, ward round, theatre, clinic, ward round over that 6-week roster. Now, when there's a tutorial or an anatomy session or rehab or sports session, or plastering or injection workshop, they take precedence, of course. And the rheumatology tutorials, as I mentioned earlier, they hold a couple of those throughout the 6-week program. So really, please make an effort to get there, because it's hard for these guys. Most of these tutors aren't actually getting paid to do this. It's all voluntary. It's all part of the hospital. The hospital supports teaching, but you're not actually formally paid for doing teaching sessions. It's only myself and a few people actually get paid partially by the university, but a lot of the guys aren't. And also, I would emphasise, it's really important, and one of the lads doing it now, but it's really important to wear a mask when you can. I've actually been a bit more lax the last few days because I've only had it a few weeks ago, but I'll be back into my full steam ahead with it in the next few days with the mask. So you hear people complain about the mask, but my job is to wear a mask every day. And so when you're in the hospital, make sure you're wearing masks, because a lot of these people are volunteers. A lot of us are older. We're more prone to get it. We don't knock it off quite as easily as the younger guys like yourselves. So please make sure you take protection in the hospital, follow the rules, and if the rats are required down the track, then to do them. Okay, it's really important. So the Royal Adelaide Hospital, that's the Royal Adelaide Hospital set up. The Queen Elizabeth, Katrina will go through that with you. But there's not quite as much, it's not clinic, ward, round, theatre. It's actually all of you can go to any aspects, whatever you want. There's not theatres every day, there's not clinics every day. Sometimes, particularly in January, it's been a bit quieter because some people are on leave. And so you'll find out which ones are available, and then you'll, between the 11 of you, work out, okay, we're going to go this way. And make sure you share it out between all 11. Some people are quieter than others and don't want to speak up, but make sure you all individually get sorted out so everyone's getting enough exposure. The common question, the one that needs to be corrected on the frequently asked questions, is how many clinics and how many theatres do you need to go to? Well, the more you can go to, the better, the more you'll learn. I remember a few of the lads that went through last year. One guy was was really keen, and when he came to the exam, he just breezed through it because it's like second nature to him. So if you appear and see things, you actually automatically, it makes it so much easier for passing the exams, which is really what your main concerns are, isn't it, really? You want to, you might love orthopaedics like I did all the way through medicine, but even if you don't, the main concern is you want to do well and get through this year. And I want you to get through the year. So we've got our timetables there. If we go back to the home page, and we come to what you'd probably consider the most important part, is the assessment. This is not quite complete yet. This is what appears on the university site. We've got our online quizzes, which there used to be last year there's a whole heap of little mini quizzes, so I've actually tried to amalgamate them into 4 main quizzes. 3 musculoskeletal and 1 rheumatology throughout the 6-week program. Most students do pretty well with them. I've actually looked at all the scores, all the questions, and tried to make sure they're even more pertinent than they were for you, so they'll help remind you of what we take as important MSK questions in them. So Sam Whittle at the moment is just revising the rheumatology quiz, which is why that doesn't appear down here yet as a highlight. At the end of the attachment, there'll be another quiz, and that's the 25% quiz, and that's another 50 questions, and you've got an hour to do. All quizzes have got about an hour to do, but the last one's got an hour to do, but only on the Friday morning through to the Saturday night of the last week. Now, actually really important, and I hope this is on the frequently asked questions, but we can add to it, is that you've got 6 groups coming through with 4 quizzes and the assignments. If I actually individually lock and start and stop all the individual quizzes and set start and stop dates for all of them, I've got to sit there for hours readjusting all the dates every year, every 6 weeks. So I've just opened it and closed it for the whole year. So theoretically, you could go in and do your MCQ quiz, at the end of the year when you're doing your attachment now, which I don't want you to do. So I'm going to be checking your scores at the 6-week mark on the Monday after you're finished and just locking those off there. So I want everything to be in within that 6 weeks, okay? Even though it doesn't say it on the table. And the only real dates that will be adjusted will be the final MCQ quiz, where there's only that 2-day period to do it, okay? Because that's just a traditional thing we've done. Yep, question?
So on the rheumatology tutorials page, they talk about post-tutorial quizzes.
Yeah, the rheumatology pages, I've spent a lot of time just adjusting everything. The rheumatology pages have to be assessed. Sam's gets back today. He's been away for the whole holidays. So everyone else have gone through, but rheumatology, the Canvas pages, everything's all up to date, except for rheumatology, which needs adjustment. So most of the information that it learns is appropriate, but the quizzes and things like pre and post quizzes and stuff, really, that's got to be corrected. And I haven't done that because I'm leaving that to Sam, and he only gets back today. So unfortunately for you, the rheumatology is in a state of flux a little bit. I mean, the information's there, but just don't, might just need to review those pages you've been to just to see if there's any major changes to it. What I've done with most of these pages, a lot of things have been repeated. So there'll be a lecture on back pain, it might be 3 times and 3 different people. And I've gone and got the best one and got rid of the other 2, just so it's not tripling up, because otherwise it confuses you on what you have to learn. So I've tried to get rid of as much. So I've still got the same information there. I've just effectively reduced the amount of information on the site by about half, even though it's the same information. And rheumatology is just in the process of doing that. Okay. as part of the attachment too. So you've got your online quizzes, those MCQs. You've got your clinical. I'll go through these pre-clinical logs and examinations workshops in a minute. Rheumatology will give you a topic report to do. We do a little essay and they'll mark it for you. Rehab will do a case presentation where you get marked at a special meeting. Sports also do the same. And we've got an end of course examination, which is that 25% summative MCQ. So these key clinical logs and clinical examinations, there used to be a sheet which had I mentioned this yesterday, what's the term, Brooke? You know those, it's got a name for like from 0 to 5 or 0 to 4. It's got a special name for scoring. Yeah, it's a rubric, but it's got a special technique for numbering it. And most people only gave 3 or 4 for it. You either didn't do it at all, in which case you came back and did it another day. So you're either useless, in which case people would say, look, I'll come back and do another one. But most people, when they were ready to do it, did it, and they were either fine or they were excellent. Okay, so I made it easier by just doing a score sheet that is a lot more straightforward. So we've got our attendances for clinical logs. You date, the clinic you went to, and you either attend, or if you're absolutely perfect, like the person goes, God, you know your stuff really well, you get an exceptional mark. So for these, theoretically, you might only get 50%, okay? But really, you make up so many other marks. You've really got to work hard to fail this course, okay? So it's actually really hard. So this is the idea. So you turn up, and if you go to 4 rheumatology clinics, it's fantastic. You learn a lot of rheumatology. But the minimum number you need to go to is 1 to get a mark, okay? And it's like any visit to a hospital, or to the zoo, or to the NASA Space Museum. The more you go and look around and ask questions, the more you'll learn and the more it will become natural to you. So I'd encourage you to go to as many clinics and outpatients as possible and theatres. And this is the clinical logs which you need to get signed off on. So rather than have 0, 1, 2, 3, 4, you've either got 1 or 2, okay? You either attend and expect most of you are just going to attendance, all right? Because you won't be perfect at the start, all right? And don't get too caught up on that score sheet. Yep.
So you only have to did you just say you only have to go to 1 session to technically get a mark?
That's correct. So if you go to 4 of them and you get 1, 1, 1, and the last one you get 2, your final score is 2. Okay? So it's the best score. It's not the average, it's the best score. So the more you go to, the more likely you're going to get a 2 for it. Okay? If you get a 2 the first day and you don't want to go to any others, that's up to you. But really, if you get a 2, you're that good, you probably should go back again and show off. And you'll probably find it even easier for next time. So that's the idea. And that's in the frequently asked question. We've got rheumatology clinic, orthopaedic clinic, theatre, and award round attendance. Okay. Now that's not a hurdle thing. It's just a score. It's only out of 8. Okay, of the final score. So it's, that we might change to I think it goes back to. Let's close that. It's a score out of 8, but it counts for 10%. So if you get 7 out of 8, it'll be multiplied by 10 is, I don't know, about 88% or something like that. If you get 4 out of 8, it's a 50% score, but it only accounts for 10% of your score. So you'll be thinking, geez, I'm going to get as a pass if I just attend and don't get 2s for everything. But honestly, you'll make up scores everywhere else that you won't need to worry. But this is really to encourage people to get signed off on everything. Okay. The key clinical logs and workstation, however, is a compulsory one, is a hurdle station, and this is the score sheet for this. And again, you've got spine, upper limb, lower limb anatomy, joint injections, plasters, and whilst you can't enforce attendance at the university, if I give you an attendance score of 1 and it's a hurdle exam, then unless you get lots of 2s everywhere else, you have to attend everything to get a pass, right? And it really is not. You've got 6 weeks to get signed off on doing 1 shoulder exam, 1 spine exam, and a elbow. So it's really not that hard. Now, everyone always seems to wait till the last week and suddenly come here with 5 different examinations they want to get done. But if you get yourself organised, it'll be much better. Okay?
Gavin, just as you probably know with the RA students, we do an allocation of them to the clinics.
Okay.
They're not. It's so.
So just what Zoe's saying is just look at your allocations. Not even if you're on a clinic weekly roster, you might be at different clinics. So the week that you're on for clinics, you might not be attending clinics every day. You're saying because it's allocated to a certain number of clinics.
We allocate if you read the instructions on the page for the timetable, you'll each given a code, like a B1, B2 or so on, and you'll be able to then interpret the schedule in terms of the allocation for clinics and there's also an allocation towards, and so we've tried to make it fair and even so that we've given everyone the opportunity to go to some rheumatology and some orthopaedic clinics,
but
and
obviously,
also the spinal
obviously
clinics, of which there aren't many.
Yeah.
So
obviously, only when you're in the clinic week where you go to those clinics, you won't be going to wards when you're in the clinic week. And when you're in the ward week, you'll be going to the wards, but not the clinics, etc.
Yeah, so it's a bit different because that's how the RA is organised, but then the TQH is organised in a different way. Yeah.
Okay, so just look at the
So if
look
you
at the.
read the timetable page and the instructions on the timetable page, and what you need, it should explain.
Yeah, so there's a whole heap of instructions there.
In terms of
Yeah.
allocation to clinics.
So once you finish and get all these sheets signed off, then you submit them yourself. And this is one of the problems too. The actual last sheets were a bit difficult to read and interpret, and I presume that's the reason. But a lot of people are putting the wrong scores in the sheets. Okay, a lot of people are actually underscoring themselves. So, but some people are putting full marks or a lot higher scores, which really, if you're scoring and it's a mark, that's not good. So we've made it as easy as possible to score yourself, and make sure you do it accurately, because last year we audited them all, but really we just want to make sure you enter them as accurate as possible. So this makes it a lot easier. It's only a score out of 14 or a score out of 8, and score out of 28 or 8, of which there's 14 marks and 4 marks. Okay, and you submit them yourself. You submit them through this section here where you link them to the clinical upload. So once you've got them signed off, you submit them yourself. Going back to the home page, so that's the little assessments throughout the 6-week period. At the end of the 6 weeks, you'll have your OSCEs. Everyone asks what that is. Usually, I don't know if it's a secret, but it's, often three orthopaedic MSK stations, so 2 orthopaedic and 1 rheumatology. And then you've got at the end of the year, you've got your MCQs written exam to be assessed on. So the actual 6-week period, though, is actually pretty easy. This lad said to me, it's a lot to learn. I agree. There's a lot to learn. He says, how do you go to the wards and you go to theatre and you learn all this stuff? But really, when you get there, a lot of the time you might be on the clinic week, but you might not have a clinic that day. And you've got the whole day where you can actually sit down and actually catch up on your study, be prepared for the next clinic you're at. So okay, the next clinic I'm at is a hand clinic. I'm going to read up a little about the upper limb and hand surgery beforehand, so I've got a good idea. So I take advantage of that clinic and learn about it. And when the consultant goes to see a patient in 2 minutes and the patient's sitting there waiting to get their consent signed, you can go back in and say, I'm going to re-examine that limb. So you want to be prepared for it. So you actually find there's a lot of more spaces than you think, and so there's a lot of time to read things. So going back to the program, we start off, general ideas of just general orthopaedics. We've got our information. Hopefully you've had a look at all this. So we've got a whole heap of examinations online for you to practice. And what I would suggest you do is get in the habit of practicing. So if you've got your pet dog, just make out there's a patient lying on the ground. You get your sister, get your friends. Just practice examinations all the time so it becomes second nature for you. And a key point everyone always asks, we're not like general surgeons. We're happy to examine from both sides of the bed, okay, because we're ambidextrous, okay? So you don't have to examine from one side, okay? So we've got our examinations, we've got our information sheets there. Rheumatology is being adjusted, but it goes through the major conditions. And I would actually, Sam Whittle, who's the lead rheumatologist, he did 2 podcasts with me on rheumatology. And so if you go to the bottom where you go to the podcast and look up his podcasts are excellent. He speaks really well and summarises rheumatology really well. You can almost learn the whole of rheumatology from those podcasts if you actually got enough time to listen, if you actually can take it all in at once. But it's all on this site here, so it's really good. We've got information about scrubbing and hand hygiene, which is really important, injection techniques and plastering. And the plastering will be held down at Quendersworth Hospital during week 4 or 5, I think it is. So with Tony Penn.
Week 6.
Week 6. And then we've got our emergency scenarios as well to be aware of. So there's a lot. And then we come to our Zoom tutorials. Okay, so we got these Zoom tutorials, and here we have. So orthopaedics, once a week, we'll run a clinic, a tutorial. Now, it'll either be on Zoom, or they could be all on Zoom if you wanted to, or 3 on Zoom and 3 face-to-face, where we go through examination techniques or answer your questions on 3 of them. This is how I run it. And the other 3, we do two clinical-based scenarios. Like here's the hip one, which is actually my favourite one, actually, because it's got introduced. You'll see it when you do it. It's actually introduced a lot of other possibilities with it. So there's we've got these clinical-based scenarios for you to go through. So each of you will be divided up into 1 of 5 groups. There's myself and David Campbell at the Queen Elizabeth. So all the 11 QH groups will be divided. The students will be divided into those 2 groups, and you should contact David Campbell, or someone should come to me. The lead student should come to me and say, Dr. Nimon, when do you want to do the tutorial? And I'll say, Thursday morning seems pretty good to me, and we can do it then. And or I might say, look, it's bloody awful this week. I've been doing all these lectures all week, and it's been pretty. Can I do 2 next week or something? And we'll work at a time that suits everyone. That works out. Well, obviously, it's best to do it in hours because a lot of students will have part-time jobs and things as well. So that's actually held from there. Rheumatology has the same sort of Zoom shoots, but they do it just a couple of them as well. So, and you'll need to contact the rheumatology tutorial. And that's all listed from here. Things also I want to mention. I've mentioned the exams. I've taken a liberty of taking highly detailed notes, which I can't read. I think that's most of it, actually. I think it's time for questions. Any questions at all? Actually, we're actually up to almost time anyway. Any quick questions before you go to scrubbing?
If we're on theatres today, do we go to that after we finish our workshops at top?
Yeah. So really important to get through all your things, compulsory things today. So scrubbing, you're at Queen Elizabeth or Adelaide?
Or Adelaide.
Yeah. So as soon as you finish here, I'd go down to 4G. And introduce, find out, look and see where the theatres are going. Obviously, the registrars won't be easily identifiable, so you'll need to ask who the orthopaedic registrars are, and see what theatres. Say you've just come straight out of it. I presume you just double check you're allocated to the theatre as well, and then go in from there. So if you've been allocated this morning for theatre and you've spent the whole time scrubbing, it's not so ideal. But get in and see what you can get in. Look, it's a lot about taking the initiative here as well. The last 3 years have been sort of spoon-fed. We're still doing a fair bit of that with this, but we're trying to get you to take the initiative and go from there. Do ask questions, but do have a look around and play with it as well, and you'll probably get the answer from the Canvas side anyway, because I have spent a lot of time trying to make everything perfect. But I'm sure there's some mistakes and things here, so please do not hesitate to let me know, and I'll correct them. If you say, look, there's a wrong link here, or this isn't right, or someone said this, I'll look at it and check it out, because I want to make it even better. Everyone can always be perfect. Not everyone. We can always aim for perfection, but everyone can always be better, so it's always good to try and reflect on what you've done and make it better if you can, and that's what I try and do. And I spent a lot of time this last few months doing that.
Just quickly, last year when we did our exams and had them signed off, we had to have it done by people of a certain rank or higher.
Yeah.
Is there that same sort of requirement for exams?
Yeah, it's best if it's done by the consultant or the registrars if possible, or the service registrar. Yeah. But for the ward rounds and things, if you're really struggling, you could get it done by the intern, but it'd be best if it's done by a registrar or service registrar. So if there's a reason why you couldn't get them to sign it, you could actually put a note saying that they were headed away to theatre, so the intern signed it, but I was there on the ward round, etc. So, yeah. Okay. All right. So I've tried to make it as smooth as possible for everyone. Any other questions at all? All right. Well, look, welcome again. I hope it goes really well for you. We really, as I say, really want you to enjoy the attachment. Most people find it really good, and it is overwhelming with the amount of information to try and take in, but I think you've got a lot of time to look at it all. And last bit is textbooks. I really like, I must be the only person though, because everyone seems to always mention the ortho bullets. Ortho bullets, if you know your orthopaedics, ortho bullets are great reminders. There's so many dot points for it all, or they've already jotted it all down for you. But Aptleys, I find it's brilliant. Every time I read it in different sections of it, you don't have to read that. Maybe I've just got good at speed reading, but if you actually, I would actually print off Aptleys and then just get a highlighter and circle it off and make my own set of little notes for it. using Appleys. But Appleys is the gold standard for the whole textbook, but also Bullets has got the points to take in as well. And please don't try and remember, like, you know, you'll read it and you might come across avas necrosis, and it'll be the 4 stages and the different aspects of trying to treat it. Look, if you actually identify it's avascular necrosis, you're doing well. It's like a broken hip. The key thing is, everyone's trying to remember, we want you to know the guarding classification and why you do hemiarthroplasty versus fixing and stuff like that. But trying to remember the intricacies and the 4 different types of staging systems as opposed to as one. And, you know, half the time when you're down in the clinic, I say, what do you see? And the students are struggling to even see the break in the first place. See, you know, there's not much point in knowing all the different classification systems if you can't identify the break. So just stick with the basics first. Start simple and then expand your knowledge, okay? Get the main key points, learn from that, and then expand it, okay? Don't spend hours reading one particular condition. Look at all the main diagnoses and pick it up from that. And the radiology part of it too, actually, I forgot to mention, that is actually, in fact, I think we're actually in the process of updating the lectures to have voice on them too, but the radiology on this area here, Meredith Thomas has actually spent ages with, these are all updated lectures. She actually sent them to me on Sunday night. They all had 2023 on them. I got rid of 2023 because in case we just want to take it through to next year. Everyone confuse everyone for next year, but they're all updated. They've all just been, every one of them has been individually checked. And they've got little quizzes there to help you out as well. But some of them, like this one here, and it'll take a little while to download, but it's actually got a voice to it here, so it's got the voice here. So it's actually got some dictation to it. So they're proper lectures. The ones that don't are getting voice to them. It's just that they had trouble with the Dropbox. Okay, I better leave it there. Okay, any last questions at all? Well, welcome. And if you have problems, let me know. Remember, I'm only 0.5, so I can't always get back to you straight away, but I'll do my best to get an answer back as soon as I can. And of course, we've got our precinct officers. Guys, do you want to mention anything else at all?
Just one quick comment. Those who arrived late and those who arrived later, please sign in. There's a sheet at the front, I believe.
Yeah.
Thank you.
And I hope this video works out and we can put it online. And thanks a lot.